So with us now, Dr. Kevin Messakar, an infectious disease specialist at Children's Hospital Colorado, and Dr. Amy Edwards, Associate Medical Director of Pediatric Infection Control at Rainbow Babies and Children's Hospital in Cleveland. All right, now I want to talk to both of you about what you're seeing at your hospitals with respect to RSV. What are you seeing?
We're seeing kind of what everybody else in the country is seeing, which is just a significant surge in cases over the last 2 weeks. And one of the things I want to point out about that fact is how unusual it is that all of us are experiencing this surge at the same time. So I do infection control, which involves epidemiology, and we're used to RSV, and I know you guys see this too, kind of taking a more wave across the United States. So these hospitals will peak, and then these hospitals will peak, and then these hospitals will peak, but instead we're all peaking simultaneously, and we don't know what that means as far as what the next 8 to 12 weeks is going to look like.
And is that what you've seen as well?
Yeah, it's been very busy in Colorado, as it has throughout the rest of the country. And this really comes on the back of a busy late summer to early fall with enteroviruses. And as those waned, we saw the rise of RSV, which is really early for this time of year to be seeing RSV already.
So we keep referring to the past 2 years, right? These are the highest numbers in the past 2 years. Well, over the past 2 years, most people have been trying to keep their kids indoors and somewhat isolated. So has that in any way played a role in making children more susceptible to RSV?
Well, I think that's kind of an interesting question, and one that it's going to take some time to answer. Certainly, so RSV does not induce what we call sterile immunity. So if I get RSV, I will get it again. But what we do know is that kids who get RSV, then when they get it again the next year or 2 years later, tend to have milder cases. So there is some protection from getting multiple RSV infections back to back to back. And of course, we're missing that. And the other thing is adults are actually also very dependent on getting multiple exposures to RSV back to back to back, which they haven't been doing. And so we actually expect that what we think is going on is one of the drivers of these higher case numbers might be adults who haven't been getting exposed to RSV in the last couple of years are providing a larger reservoir of symptomatic patients than what we're normally seeing, and so that's driving more infection in kids.
And it's certainly thrown off the patterns as far as seasons. We used to have very predictable seasons for when RSV would show up. We'd staff up for it, we'd be prepared for it. And since the pandemic, those patterns have really been thrown off. It's coming out of season, it's coming multiple times per year. So we really have to prepare for the unpredictable right now.
And you're both in town for an infectious disease conference. Thank you again for coming in studio. What were you hearing from your colleagues? Was there any discussion of strategies to combat this both in the hospital and also in the home and schools?
A lot of it is preparedness work, being ready for the increased volumes we're seeing in our ERs, on our floors, and on our ICUs, making sure we have the staff and resources to care for these children the best we can.
Right, because you have to remember that RSV, while most kids do make a full recovery, they really do require fairly intensive work in the hospital. The nurses have to keep their noses and mouths suctioned to keep the mucus out of the way so they can breathe. These kids are often in the hospital 2 or 3 or 4 days. Some kids can be in the hospital for 1 to 2 weeks, so that takes up a hospital bed for a pretty significant period of time. We're not talking about in and out overnight with IV fluids. These kids are in the hospital for days. And so staffing really is key with RSV season. And as you mentioned, we just came out of enterovirus season and we saw more enterovirus activity than we were used to. And now with all this RSV, and if you look in the southern United States, we're already starting to see flu cases take a really big high jump, and so we're really a little bit concerned about this overlapping of all these different viruses, because usually RSV comes a little bit later and then flu comes very nicely after. They take their turn, but it doesn't look like they're going to be doing that this year, and so I think we're really worried about pediatric hospital capacity over the next several months.
So to that question of capacity, when do you know it's time to bring your kid into the hospital? Because we've seen some area hospitals say, look, if your kid does not have something really serious, potentially life-threatening, don't come in because we are at capacity or near capacity. So when should a parent go to the hospital, and when should they maybe just take a pause?
Sure. Many of these illnesses start with common cold symptoms that can be managed at home. It's really when it starts to impact the work of breathing. So if your child's breathing harder or faster than usual, if they can't drink enough to stay hydrated, those are times we don't want you to hesitate. We want you to bring your child in to be evaluated. That's what we're here for, to take care of kids, to get them through these illnesses. So I don't think the message should be, don't bring your child in if they're sick. You can care for a cold at home, but if they're struggling to breathe or not drinking enough to stay hydrated, we want to see them.
And in infants, though, it can be hard to know because obviously you don't give them too many fluids besides formula or breast milk. They can't clear their nasal passages. Look, they make a lot of strange noises. How do you know when it comes to an infant what to do?
Well, with infants, it can be a little bit harder because they're often lacking some of those symptoms that we rely on, the cough and the really significant runny nose. A lot of times with our very youngest babies, especially the babies under 2 months, they're a little bit more lethargic, and they'll actually start to refuse their bottle. Babies should, I mean, their infants' number one drive is milk, 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 milk. So
tell me about it. I have a form adult, yeah.
So the babies should not be refusing their bottle, and that's often one of the first signs we see that RSV is getting out of control in these infants is they start to refuse their bottle. You start to have trouble waking them up, and again, any parent of a newborn knows that babies wake up. They wake up crying because they want their bottle. And when you stop seeing that instinctive need for fluid and the diapers start to dry up, that's going to be a big sign that baby needs to come into the hospital.
All right, so really quickly, what's your number one piece of advice for parents to keep their kids safe?
So the prevention of transmission of these diseases is the routine infection control advice. Wash your hands with soap and water, cover your sneezes and coughs, stay home from work and school when you're sick, wear a mask if you have symptoms or are in crowded public spaces. And then I think the last point that was made is we're starting to see flu, and that is a preventable disease. We have a vaccine for it, and because flu season is starting early, we want people to get vaccinated as soon as possible. And really everyone over 6 months of age that is eligible should be vaccinated as soon as possible against flu.
And I want to make one last point. So I've been seeing a lot of misunderstanding. This is a respiratory virus. Why do I need to wash my hands? I don't understand. So not all respiratory viruses are spread the same. So influenza, SARS-CoV-2, these are spread by droplet. SARS-CoV-2 can also be spread by aerosol. But some respiratory viruses like rhinovirus and RSV really are spread by that close contact with the respiratory secretions, and the virus can live on your hands for 30 minutes, an hour. So it really is important to be washing your hands frequently during RSV season. And what might be a minor cold to me, or maybe I think it's allergies, could be a devastating illness in a young infant. So we really do encourage people who aren't feeling well to keep their hands to themselves and don't kiss those cute babies.
And don't complain about washing your hands. It's
just good
sense. All right, doctors, thank you so much. Really appreciate it.